Stop for a moment. Look at your hand. Make a fist and open it. That took less than a second, but inside your arteries, your body is responding to what you eat and do hour by hour. I'm Professor Alexei Kalmykov. Today, we'll talk about what nutrition science can and cannot promise about anti-aging. No miracles, no shame, just practical physiology, especially for adults over 60. People rarely die because time ran out. Even in centenarians, autopsies typically find a specific organ failure or disease process. So the goal is not to chase a fantasy of reversing aging in 4 hours. The goal is to reduce risk step by step while protecting strength, balance, and independence. There's a measurement called flow-mediated dilation, FMD. It's one way researchers estimate how well the inner lining of arteries responds. Studies show that a single high-fat meal can temporarily reduce this response over the next few hours. That does not mean you aged overnight. It means your blood vessels are responsive and your choices matter. If you want a more artery-friendly pattern, focus on less saturated fat from processed meats and pastries, more unsaturated and fiber from whole plant foods, more minimally processed meals more often. And yes, nuts can be part of that. Walnuts are one option. Almonds and other nuts have also shown vascular benefits in research. But please remember, nuts are calorie-dense, can be a choking risk, and are unsafe for allergies. If chewing is difficult, choose ground nuts or nut butter. Now, an important correction. Older adults are not served well by blanket protein restriction advice. For many people over 60, expert groups often suggest protein intake around 1.0 to 1.2 grams per kilogram per day, sometimes higher with illness, weight loss, or frailty. If you have kidney disease, your target may be different. This should be individualized with your clinician. Here's the balance strategy. Keep protein adequate to protect muscle. Prefer higher quality sources, legumes, soy foods, fish, dairy if tolerated, and nuts and seeds. And use resistance exercise safely because muscles need a training signal, not just calories. Strength training helps preserve function, but it must match your level. If you have osteoporosis, severe joint pain, dizziness, chest pain, or recent surgery, get clearance and consider supervised training. Stop immediately if you feel chest pressure, severe shortness of breath, faintness, or new weakness or numbness. One more topic, without embarrassment. Some people notice a change in body odor with age. A compound called 2-nonenal has been associated with aging-related odor chemistry. This is not dirty. It's biology. Can diet help? Possibly. Some small studies suggest mushroom extracts may improve odor-related outcomes, but don't expect instant erase it from the inside out. Think of it as one supportive habit among many: hydration, hygiene, clothing fabrics, and overall diet quality. Finally, supplements. Please don't self-prescribe high-dose minerals based on internet fear. Calcium. If your diet is low in calcium, food sources are a good first step. But if you have osteoporosis or documented deficiency, supplements can be appropriate under medical guidance. Iron. Do not take iron unless deficiency is confirmed. Iron status is measurable. And never use blood donation as a detox. Donation can lower iron stores and may cause deficiency. Here's a safer 24-hour plan you can adapt. Make one meal plant-forward: beans or lentils, vegetables, whole grains. Add a small portion of nuts if safe for you, or choose nut butter. Include a protein source at meals, adequate, not extreme. Do a simple, safe strength activity you can control: sit to stand, band work, or supervised exercises. If you have osteoporosis, severe joint pain, dizziness, chest pain, or recent surgery, get clearance and consider supervised training. You don't need fear, you need a plan you can repeat. Reduce processed saturated fat, build a plant-rich pattern, protect muscle and balance. That's how you support healthy aging, one day at a time. I'm Professor Oleksiy Kalmykov.